Here at St. Joseph Hospital, we are the flagship hospital for orthopedics within the central and eastern market here in Kentucky. And so my focus is hip and knee replacements. We do about 700 total joint replacements a year here at St. Joseph Hospital. In the event that a patient is a candidate for a joint replacement, then the next step would be to schedule surgery, in particular schedule a date. Here at St. Joseph Hospital, once that decision has been made, then the next step is a meeting with Lyons, who's our orthopedic nurse navigator, and attendance at the Joint Academy, as we call it, which is a very comprehensive preoperative education class that really takes the patient through the entire process about what to expect.
So Joint Academy class is a preoperative class that our joint replacement patients have to go through. A lot of times I find that patients aren't really looking forward to a 2-hour class when they're in pain with their need for joint replacement, but overwhelmingly we get great feedback from the class. Patients are extremely satisfied and feel that they are more prepared for their surgery, and we set it up almost as like a roadmap for the entire process, starting with pre-admission testing throughout their hospital stay, the surgery, the hospital stay, and then throughout the rehab that they go through after.